it is really, really important that we identify AFib, even the asymptomatic one, at an early stage so that we can hopefully treat it appropriately. So common myths about AFib. So one of the common myths is AFib always has to cause symptoms. That is not true. Proportion of the AFib population does not feel AFib. And the reason is that sometimes AFib can happen, but your actual heart rate is normal or even low. And that's because heart rate, the way we measure pulse and so on, is controlled by the lower part of the heart, which are called the ventricles. AFib is a disease of the upper parts of the heart called the atrial. So although the atrium or the upper chambers of the heart are in AFib, the lower chambers are kind of beating at a normal heart rate. And identifying the asymptomatic population can be important, especially in older patients, because a lot of them can have AFib on and off, and then they would have a stroke. Another myth, AFib is not dangerous. This is something that some of those patients who don't have symptoms tend to think. They're like, you know what, I feel fine. I'm doing well, I'm exercising and so on, which is great for them. That means that the AFib is not really affecting their quality of life, but that doesn't mean that they're protected from stroke. So again, that's the other big problem here, is that if you have AFib, don't ignore it, see a doctor. You might need to be on blood thinner, you might need to have some kind of procedure done.